case study of a rapid methodology implementation. Very quickly, I'm not sure if other folks from CMIPS have talked about our work here at the center, but we have a sub-program within our Center for Methods in Implementation and Prevention Science called the Qualitative Methods Innovation Program. What we do is bring together qualitative scholars and qualitative researchers that anchor their work in implementation and have seminars throughout the year as a part of the other methodological seminars that we have at our center. And a part of what we do is, so one big project, oh, sorry, I didn't include the email. I'll send the email. One big project that we did have was a really large scoping review of how qualitative methods have been used in implementation science. It should be coming out in publication soon. The publication process for that paper has been amazing. But we basically look at how do people sample? How do people talk about saturation or not saturation? What methods do they use? Are they observations, field notes, visual, ethnography, lots of different things. And so it's a very cool paper. So we have some of these like larger methodological studies that we do. And then of course, just the work that all of our collaborators do that are really anchoring in how do we use qualitative methods in a really useful way. So I'll send the email if you want to get on our listserv. We have folks from all over the world because we have collaborations all over the world, and we really welcome you joining that program. Okay, so why are we interested in rapid research approaches? Probably the reason that we're interested in getting our projects done in the first place, but we want to save time. Or in fact, the better idea is that we have to do something fast. So there's no reason to use a rapid methods approach if we don't need the results right now. So that's one thing that I'll sort of pull with us through this whole talk is that really it's not just saving time, because we always want to save time in our projects, but it's really that we need to give immediate and timely feedback in order for the implementation project to move forward. Of course, if we save time, we're going to save money. But at the same time, we really want to maximize our data quality, right? And maximize efficiency. How long does rapid research take? It really varies, and it really depends on the project, because again, your rapid work is going to be depending on your timeline and your project and what is happening in the implementation of your project. You know, they can be done as quickly as 3 weeks. Normally, that's more like needs assessments or something like that. I wouldn't say you could probably do data collection and analysis in 3 weeks. You know, probably more likely the process would take you 3 months, depending on what stage you are in. But typically, and frankly, like most of my projects, I would say from when we start our data collection in our implementation trial, and then we're able to get information out and consolidated and aggregated, it's probably somewhere around 6 to 9 months or sometimes a year. There are lots of different terms that, you know, rapid methods aren't new. We've been doing rapid ethnographies or rapid assessments and things like that for decades and decades. But so these are some of the terms that you might see out there. Many have a formative focus because often we're trying to learn something really quickly before we do something, right? So those formative ones are like rapid assessments. There's something called Rapid Assessment Procedure Informed Clinical Ethnography, RAPICE, that was designed and developed by Larry Palinkas, where he teaches clinicians to be ethnographers. So it's people that are living and working in the particular implementation site, and he teaches them how to do ethnography and then involves them in his study teams. And then, of course, there's rapid or quick ethnographies that have been done, again, for decades. Of course, there's also rapid evaluation. So you'll see like real-time evaluation, rapid feedback evaluation. These are all sort of terms that different folks have coined. a lot of these you'll see are really anchored in anthropology and ethnography, which is sort of the cornerstone of anthropological research and practice. And so I like to share this quote from Malinowski about kind of why ethnography can be so important and so crucial to understanding context, right? In implementation work, we're really trying to understand conditions and context. So he says to study the institutions, customs, and codes, or, right, what we mean by that is studying behavior and mentality without subjective desire of feeling by what these people live. Realizing the substance of their happiness is, in my opinion, to miss the greatest reward that we can hope to obtain from studying humans. So really it's understanding what makes people thrive, what makes people happy, what makes people do what they do in their particular culture and context. And that's what implementation work is really all about. So what do all of these different approaches have in common? Because they are, sure, different methods. But the data and collection and analysis are happening at the same time. So you're getting data, and as you're getting the data, you're also analyzing what's happening. I'll sort of show you and demonstrate to you what that means. And it's also usually happening with some type of triangulation. That means you're collecting data and analyzing data and then comparing or considering that data in relation to other types of things. Maybe it's patient outcomes data, maybe it's clinician uptake or something like that. But you're always triangulating usually with some other stuff. Another cornerstone is that rapid methods develop a feedback loop. So you're iterating your data collection. So meaning you're changing the questions that you're asking and what topics you're focusing on to be responsive to that particular context and to learn with your data. So if you're asking something about one thing, you're finding that it actually doesn't really matter. You're not going to keep asking that qualitative question. You're going to change it in order to be responsive to what is happening and what you're learning. Rapid approaches nearly almost always exclusively happen with teams. You need to have a team, a fully dedicated full-time team. I'll talk more about this in order to have a rapid process, in order to make this fast. So just because it's fast doesn't mean you can have, a couple part-time people. I think the part of what makes it fast is that you actually like throw a ton of resources into only the qualitative stuff. And I think that's where people get a little bit frustrated, is they're not having like the proper human resource capacity to carry out the rapidness of this. And then, of course, we focus on an insider perspective. And so really drawing on insiders and people that living and working in the implementation context to be a part of your team, a part of your research process. And so really what I have in red here is like, think about your research, right? Think about your research team. Do you have insiders on your team? If not, who could those be? And who can help you facilitate a deeper understanding and nuance? And so I'll give you a couple examples from our work. We always have a community board of individuals with lived experience of whatever it is that we're studying. So if it's emergency department physicians screening for suicide, we're gonna have an emergency department physician on our study team. So we're going to pay them. They're going to be an official member of our study team. They're a co-investigator. They're an analyst, but they're on there. Maybe someone has lived experience with suicidal behaviors or a family member that they've lost to suicide. They're also going to be a part of our data collection and analytic team. So they are from the place that we are studying. When you have national, right, like really large scale implementation studies, you just lift this up a little bit to think about like who are the necessary representatives to make sure that I have some lived experience on my team. A part of the way you make it rapid is by having an insider that already knows culture and context that can help facilitate the work. As an outsider, especially I do a lot of global health work, I'm never going to be in a good position to be in that role. So my teams really have to be anchored in the communities and the institutions within which I'm studying, and they have to be a paid team member. So rapid approaches are a package. And so it's not a single analytic strategy. I think this is something that's really important for us to really think about, is that we're usually doing a bunch of different things at the same time. That's why I like to think of it as like a collection of stuff. So we have a collection of methods, right? Surveys, secondary data, qualitative interview data, observations, meeting notes, historical policy documents, right? All of those things are sort of anchoring as our data sources or methods that we're using to get those, and processes, right? So we're using participatory approaches, we're using iterative approaches, and we're using triangulation analytic methods in order to process the data. So I've just collected a bunch of important questions for us to think about as we are designing our analytic approach within our implementation study, right? So we need to make sure that the research objective matches something that's appropriate for a rapid method. So usually what that means is we have a very clear identified research question that has some deductive frameworks or categories or things that we already anticipate are going to be relevant and important, right? So usually rapid methods are not helpful in developing new theories and really understanding nuance and context because you don't have that much time. But if you're identifying like what are key barriers, what are key facilitators in specific domains, right? That is probably appropriate. It's also important, right, in order to know if you have deductive categories that you're already working with, to have a theoretical or conceptual framework that is already guiding your study. So you already have those key categories that you know you care about, that you're gonna be concerned in analyzing within. And so I imagine there's been lots of talks about implementation theories and frameworks. And so again, like implementation science lends itself quite well to doing something rapidly. And then, of course, understanding what sources of data am I collecting from and what am I triangulating, right? Like what observations, like what clinics am I observing? How many days am I observing them? And what do those notes look like? Who am I talking to and doing qualitative interviews with? What emails or meeting minutes or whatever other sort of process workflows am I considering and incorporating? And then, of course, when are you going to collect data? Who's going to collect your data? Do you have enough team members to really do something rapidly? And I'll talk a little bit more, like specifically, again, it always depends on scope, but you need at least, like, I would say at least 3 full-time people that are only anchored in the rapid qualitative sort of part of your study. They're not doing other things. And then what are your results for? So probably the most important decision here is, why do you need analytic methods? And so usually what we're doing with that is we're informing scale, right? So we're picking like, hey, what implementation strategies seem to be really useful that people want to do and uptake? And how are we going to feed that back to the team in order for us to take things to scale? Or, hey, we tried something and we saw that actually the implementation, there's no more uptake, or I don't see much spread, or it's not acceptable. So I'm going to use these rapid methods to quickly figure out why, in order for us to change the strategies in order to, right, get our evidence-based practice with more uptake. So again, when do we use these rapid methods? It's typically deductive. So your research question has to be able to be answered using rapid analysis. I'll give you a couple examples in a minute. You have to really need the results quickly. My teams, I would never do a rapid analysis if it really wasn't necessary. And so I'm not using it all the time. I'm only using it sometimes when it's really important, that we either have to like adapt and tailor an intervention quickly. So we're using some dynamic models or dynamic adaptation frameworks. So in order to be dynamic, we need that rapid iterative qualitative stuff. Or we want to support program improvements iteratively, or the healthcare or community stakeholders really need information in a short time because they're going to pick right? In like a COVID pandemic era, they're going to pick what they're going to do next, right? Like it's really real time issues that we need to quickly pivot or make decisions. I don't use rapid methods if I just kind of like want to get the work done sooner, because actually there's better ways if I can take a longer amount of time with the data in order to really understand its nuance and context. And again, the most important thing is that your team has capacity to complete an analysis in a compressed time frame. And that means you need several full-time staff that are only doing this work. So when don't you use it? Again, if you're exploring a new topic, it's something you really don't know about, it's something you really don't understand. Sure, there are some things we can do rapidly, but it's not really going to fit in a rapid analysis. So sometimes we'll go into a place and we'll do some rapid ethnography to understand how people are conceptualizing a problem. But I wouldn't really call that like a rapid methodology. It's just a rapid method, right? It's a way for us to quickly get information. If we're trying to develop or refine a new theory, so a lot of times, often in my work, there's not theories related to suicidality that are really anchored in that particular culture and context. Actually, all of our theories for how and why suicide occurs are anchored in the West, in sort of European or Western frameworks. And these don't necessarily match what's happening in Pakistan or what's happening in Nepal. And so we take time to develop a grounded theory of suicidality most of the time before we start doing any intervention work. That's not quick. And then, of course, there's other things, right? If you don't have a clear framework or a deductive structure, it's not going to work well for you. You can use rapid methods, and this is often how I think about it and how I use rapid methods within my projects, as like one piece of a larger project puzzle. So in this example, maybe you're doing some longer term research and like there's one quick thing that you need to figure out quickly, right? Or you can sort of pivot from using longer term research to inform a rapid project, and then that's going to inform some more long-term research. Certainly you can do rapid stuff, and this is probably a lot of how it's been used in the past, is you're going to quickly try and figure out what a problem is, and then you're going to design a longer research study. Or you can use them in isolation. I have never used rapid methodologies in isolation, just know that. So I'm not well informed to advise you on that specific approach. All of our rapid stuff is usually in the middle of a longer research project. So this is a well-suited question for a rapid research, right? What are the facilitators and barriers to the implementation of a universal diabetes screening uptake in urban Kathmandu hospitals, right? We want everyone to screen for diabetes in Kathmandu hospital clinical settings. Why are people doing it? Why are people not doing it, right? So that's pretty easy. We can have an easy implementation framework that's going to be advising some of that stuff and use our sort of rapid methodologic design to answer that question. Something that's not well suited is how do Nepali adolescents perceive and negotiate diabetes diagnosis, right? That takes like a longer qualitative inquiry and a longer analytic process. Okay, I'm going to pause. I'm happy to answer questions as I go, and my students always tell me that I talk fast, so also tell me if I need to slow down. Okay, I'm going to keep going. Okay, so what are the broad structure and components? I'm going to walk you through this.
Do you hear me?
Oh, yes, I can.
Oh, seems like we need to switch on mic. Actually, there is one question from the audience. Yep.
Hi, Ashley. This is Mona Sharifi. So
Hey,
nice
Mona.
to meet you, and what a great talk. And very comforting to hear that it's not atypical to do a rapid analysis and then have to do a longer analysis. Our team experienced that and had some insecurity that we did it wrong, but it's great to hear that that's your norm too. But I was curious, you mentioned the insider role and how critical that is in your teams. I really appreciated that. I was curious, do you always have the insider serve as like a coder or like a key, like a, sort of, I always think of analysis groups typically have sort of the core group, and then they have sort of the broader group that might like review themes and give higher level feedback. And just with busy clinicians, I'm curious if you always have them be part of that sort of core that's kind of coding, or if that more peripheral role has worked well.
Yeah, normally I won't have them. We never are privileged enough to have them full time. So usually we have them part-time. And what that means is they're a part of all of our like research team meetings, and then they'll come to analytic meetings. So our team will be processing the data. And then the sort of our lived experienced person, if it's someone that has another full-time job where we can't really get them for more than 2 hours a week or something like that, then they would just have to be at those analytic meetings, right, where they're talking about what the core findings were, but they wouldn't be doing work in between, if that makes sense. Of course, they would be involved in designing all of the guides and the questions, and then they would help make decisions on how to pivot or iterate. But yeah, as far as clinicians, they're usually at analytic meetings, but they're not processing data. But actually, in a lot of our other projects that are forthcoming, we're actually testing if we use people with lived experience as the data collectors. So we actually do hire them in almost a full-time capacity. Do we get different data? Do we get richer data? Do we get better data? So we would actually be like stratifying our data collection team and comparing how some of these things are being done. Okay, so I'll walk you through the broad structures. So I think about sort of a broader rapid methodologic approach as sort of 3 overlapping phases. So there's the formative work and training phase. So I'm going to bring you kind of like left to right. And in that formative work, I'm forming my team, I'm training my team. Everyone here knows that that your team is gonna like have some attrition, people are gonna leave and other new people are gonna come on. So we always try and systematize, like we have a pretty core training curriculum, and then a way of like integrating them into the team. And so with that team formation, we're together going to be doing some of the formative scoping. So that's reviewing policy documents or like key policy changes in the implementation context, history of whatever those institutions are, and just like current kind of what's happening, what's going on, what do people generally care about, and what are they spending most of their time on and why. So that might be attending some meetings at your implementation sites, doing some like site visits and just like really general kind of observations to understand what's the structure like, all of that stuff. And then of course, drafting our data collection tools, right? What do our observation templates look like? What do our interview question guides look like? And so with that, we're also drafting the analytic tool, which is what Cynthia Vendrola-Padros calls a RAP sheet. So the Real Lab, RREAL, out of, I think, University of London. Cynthia leads that team, and they've sort of developed this like RAP protocol. And so that's often what we use with our teams when it makes sense. And so what happens is when you get into the data collection phase, you have your iterative interviews or observations or whatever method you are anchoring, right? So that's what I have up at the top here with this iterative data collection. And then every time you do an interview, what our teams do is they listen to the audio. We don't transcribe because we're often doing things in multiple languages. So that's another thing that like really, I actually don't know what the context is like where you are, like how many indigenous languages there might be or like different dialects. But where I work in Nepal, there's more than 100 different languages. And we're often working in like 3 or 4 languages. When I've worked in Ethiopia, we're always collecting data in at least 3 or 4 different languages. And so we have to pick an anchor language that the RAP sheet is really focused in. In Nepal and Pakistan, it's always in like Nepali or Urdu. We don't like moving it to English because you lose so much. And when you're doing a rapid analytic process, like you're already losing a ton of data. And so again, like pick the best anchored language. For us, if we're collecting in Nuari and Tamang, then we're still going to anchor it in Nepali. So anyway, so you're going to quickly take that information from the data, listen to it, write up your quick bullets in the rap sheet. Whatever's in that rap sheet gets put into, right? Your lead analyst is going to put it into a matrix. I'm going to show you what all this looks like. As you're doing that process, when you're doing your interviews and putting things in your analytic template, you're going to see that certain questions have to change. And so you're going to make those like iterative revisions to your guide as you keep doing this process. At the beginning, with every rap sheet you create, we're going to want regular team meetings. Depending on how fast you're doing things, these are going to be every day. Every day, right? You're going in the field, you're doing some interviews, some observations, you're coming back and you're doing your analytic template, and then you're meeting as a team to talk about the results. It's literally every day. Maybe in some other situations, it might be weekly. That's like far in between for a rapid process. And so again, like if you really need it fast, right, you're doing it every day. So what's happening is then you're going to take things from that matrix and make a whole summary rap sheet. That summary rap sheet, those are your findings. That's how it works. And then you can write up those findings, right, for whatever you need. Maybe it's for an implementing team to make scaling decisions. Maybe it's for a strategy package. Maybe it's for a publication or a report, right? So all of those things can work. So again, we have lots of possible data collection methods. I typically actually use these 4 in all of my studies. So I'm going to be doing in-depth interviews, right, which are longer one-on-one conversations that take usually 45 minutes or more. I'm going to be doing observations. Usually I do embedded ethnographic observations. That means I'm staffing someone in the implementation site and they're becoming like a part of the study team. So in a lot of our like suicide screening implementation research, I staff an ethnographer in the emergency department. They help with like general daily tasks. So they would just be like another set of hands in a really chaotic environment. But then they also really understand the subtle working dynamics, which in an in-depth interview, no one is going to tell you because it's really hard to like cognitively think about that when you're being asked it directly. We do a lot of focus groups. I could do a whole talk on focus groups and how we do that, but those can also be a source of data. And then something called periodic reflections. This is a method that Erin Finley, I have the citation down here, does, which I really appreciate when people are really short on time. So often we don't get the luxury of doing in-depth interviews or even like 30-minute interviews. So a way that that Erin Finley has sort of designed is these really brief kind of like reflections or check-ins. So it's not a one-off thing. We're often talking to someone multiple times, but for really short periods of time, 5 minutes, 10 minutes. So usually if I'm working with like 40 implementers, right, I have 40 people that are implementing a particular evidence-based practice, I'm going to talk to them once a month for the whole implementation period, but I'm only talking to them for like 10 minutes. So at least they can like every month kind of reflect on what's happening, what's going on. But again, that like I have a template and then I extract the information from that really brief reflection into my template and then it goes into my matrix and I can analyze that data. But it's a way of like sort of spreading out your data collection with one person over time. So you get more of like a longitudinal and like kind of more real-time memory of things. Of course, you can also use a bunch of like secondary data, which is emails, meeting minutes, sort of things that are happening in the implementation site as things are going on. Okay, so this is just one example of working in multiple languages and embedding a rapid analytic project into a larger implementation study. And so I'll just sort of take you through. So you can see we had like a pretty rapid data collection window. So this was for a national scale up of improving maternal and neonatal care in Ethiopia. So we had 6 weeks of data collection. We trained our field teams in about a week. And then we all went into the field in 4 different sites, and they worked in probably 8 different languages. And so every day they were in the field, they would go do their interviews. They would write out their field notes, and we would have a daily team debrief where we all called each other from our relative field sites and talked about how things were going on. We would iterate the interview guide, make a list of our core findings, and then go back out and do it again the next day. What happened was then we sent off the audio recordings to get transcribed and translated into Amharic, which was like the sort of anchor language of our study. But the field notes were all done in English because of people like me who don't speak all of those languages. And so oftentimes we're making decisions in English and then, you know, sort of going back out and translating it into lots of different languages. So then this sort of breaks off, right? So at the bottom, we have the rapid analytic process. So rapidly, what's happening is those field notes, we're not using the transcripts, we're not using the full data. The field notes are like getting put into matrices, and we're doing a rapid analysis to send to the national project team that had to make decisions on what to scale, right? They were interested, what strategies do we have to scale, and what's the best optimal package of those strategies in these different sort of regions. And so we were creating a matrix and drafting a report for them. That report got sent to them. They sent feedback. They said, hey, can you go back to your notes and look at these few things? So you can see there's like a little rapid cycle there around here, right? And then we get this final rapid report. That final rapid report just existed, right? So that's the rapid analysis. And we actually didn't publish that. That was like very functional and like important for the implementation team to move forward. What we did do was then we did a later thematic analysis, right? Where we said, okay, let's go dig into these transcripts that we're doing and really see what's going on in a sort of like larger, like theoretical view, right? And we actually saw some really important things that we didn't see in the rapid section. So for example, we saw a lot of cultural safety issues. So like women of different ethnicities accessing care in their home villages, but it was care that was provided by, you know, clinicians that were not from that area. And there was actually a lot of tension with how they felt safe with their own culture and practices and ways of knowing and thinking that actually like really mattered. So that thematic analysis like became a much longer analytic process that we actually then contributed, right, to the broader theory of like how maternal care is implemented in really complex cultural settings. So this is just one example of like how rapid analytic procedures are used very functionally. And they're not always used just for publication. We actually like weren't interested in publishing this. We were just interested in using it for the implementation. This is an example of a rap sheet. I'm going to walk you through a whole example in a little bit, but you can see it's very simple. So the way that we typically organize it is that we're designing our interview guide to then very clearly map on to our domains, right? So we're interested in reasons that they joined the program, right? So like facilitators for even like doing something, right? What they liked, what they didn't like, very easy, simple questions. So what happens is you can use these wrap summary sheets and you can create them for different data points or different teams, different sites, different researchers. So you can, you know, every researcher has their own sort of like aggregated wrap sheet of what they found, or every stage, like we'll have a wrap sheet for the pre-implementation stuff. We'll have a wrap sheet for the like implementation stuff or the sustainment phase, right? So we might have these different summary sheets for different phases, different sites. We're going to have one for the rural sites. We're going to have one for the urban sites or whatever. So that you make those decisions based on what your research questions are. So this is an example of how things are triangulated. So I might have one site where I have this summary, and what's feeding it are the interviews and the observations, right? And then I'm going to feed that into a master summary wrap sheet. Okay, and so that's sort of coming from every site, and they're all feeding this one master sheet. Is there a question? I see people at the Okay, maybe I'm super over time and I'm going to go fast.
Ashley,
Yes.
this is 5 minutes. No
Okay.
time. Okay.
No problem. I might have to skip the case study. Okay, so this is what the matrix looks like. So I told you that you sort of aggregate the template information that you got from the interview or the observation into a matrix. This is what it looks like. This is another example from one of my current projects. It's a trial to integrate technology and sensing technology into maternal depression treatment in rural Nepal. So we're actually collecting data from lots of different elements. And I just wanted to show you that sometimes they're field notes, sometimes they're periodic reflections, sometimes they're in-depth interviews and focus group discussions. We use a rapid analytic process to triangulate and sort of process all of this. People always ask me, like, how do you sample? You sample based on what's going to sort of maximize the variation or answer your research question. So if you're really interested in, like, what are the barriers to doing this, you might oversample sites that are not doing it, right? Like not uptaking it. So that's sort of like deviant sampling, but it's a kind of purposive sample. So I always use purposive samplings. Usually I'm looking at uptake. So here, we said, okay, we're going to get folks that were really like high attendance to these sessions that we were implementing, and then people that didn't attend a lot, right? So people that were low attendance. And then we wanted to know, like, okay, did they have a lot of change in their mental health or a lot of change in their sexual health behaviors, etc. This is an example of a populated matrix. And so here you can just see every row is a person that we interviewed. And this is the summary of what they thought about the usability of a particular platform that we were implementing, and how they thought about the confidentiality, right? And so you populate this matrix with all of your interviews, and that's where you anchor your analysis. And this is just to remind you that, there should be an alignment with your research objectives. The interview questions that you have should really clearly meet those objectives. If you're interested in barriers and facilitators, don't ask anything else. There's like lots of other things that you might be interested in asking about, but it has to be refined just to that. And it should all sort of be guided by your implementation theory, model, or framework. I will quickly take you through this just so you can see. So this is a project, just a case study that we kind of made up. Just to train people. So there's a peer counseling program to improve access to HIV care among low-income adults in the US. And we wanted to understand this program's acceptability and feasibility of delivering it remotely during the pandemic. So we were planning with the team for scaling up a remote delivery of this intervention. So these are the full-time people that are only working on the qualitative analysis, right? 2 PhD level researchers, 2, right? Like nearly full-time. 2 research assistants, probably master's level, and then 1 community member with lived experience, right? Full-time. And so this was a sort of mixed methods project where the rapid component was this qualitative component that was complementing and will be triangulated with the quantitative component. This is that same process that I showed you. So all of these interviews and the data collection is happening in the summer, so about 3 months. And then they're processing the matrices at the same time, and that took them into the fall. And then they had their findings by the spring. So it was about 9 months. So this is an example of how we created the wrap sheet, right? Here's our interview question, and then here's the topic on the wrap sheet. There's the wrap sheet. So I'm just going to walk you through, I don't have time to talk about that, but I'm going to walk you through what the wrap sheet can look like, okay? So in your wrap sheet, we use bullets. We like to just consolidate it very quickly. The hardest piece is really curating this information so that it's specific, anchored in your informant, but also like only has what you need. So we really like to incorporate the ways that people talk about, like the adjectives that they use, and we quote the adjectives that they use or the metaphors that we use to make sure that it's sort of like capturing the texture of what our informants are saying. So one example, why did you join the program? I didn't have a lot of family support. I was interested in having support from someone like me, right? So what really mattered was a shared identity. And so that's why we have quotes for someone like me, because we actually think that's really important to capture what this person is saying. So we don't have long quotes, we just have a couple words. We have analytic team discussions to decide to like talk about what we're finding and iterate the interview guide. This is again like what the matrix looks like that we're going to be producing our summary results with, right? And so that's really the process. And so those team discussions really have to talk about how the matrix is working, what new topics do you need in your interview guide, what fits your framework, what doesn't fit your implementation framework, right? So where do you need to sort of think about what's happening, and how do you connect everything together? So just to bring you back again, like that's the whole process. And really like the bulk of the work is you need many, many team members to do that middle phase. The most important thing with your team is you need strong analytic writers. So people shouldn't just be describing what's happening. They should be summarizing the content of what someone said. And that's really hard, I think, to train, which is why you just, if you can hire strong writers, right, like analytic folks, you're going to have some really strong rapid data. The way that we talk about rigor is by having these team meetings all the time, by bringing information back to our community advisory boards. We have ongoing training and we have iterative checks. So we always do quality checks, like someone's either listening to the audio and then referencing the rap sheet. And we usually have 2 analysts per interview. So we have a primary analyst and then we have a secondary analyst. And so that sort of double analysis, again, like makes sure that there's consistency and quality. And then people always ask me, well, can you publish it? And yes, absolutely you can. The most important thing with rapid work is making sure that you're very clear and transparent about all of your data collection tools and exactly what you did. So if you include the matrix with all the domains, like as a qualitative methodologist, I would review that and really consider kind of what the strength and rigor was. But as long as you're transparent with everything and you provide everything, there's so many examples of people publishing this. All right, that's it. I will stop talking now.
Thank you so much, Ashley, for this lecture. In this rapidly changing world, indeed we need rapid research, and your description of the approaches was so well comprehensive. Thank you so much. Yeah.
Everyone.
Unfortunately, we don't have time for questions. But if somebody is burning, we do it with it. Let's do just one, perhaps, because we are behind. This is the evening time, and well, I don't want to tire you too much. So okay, let's move. Ashley, thank you so much.
Bye.
Yeah, please, I think you should stay because you are on the last panel, if I'm not mistaken. No. Okay. Then, yeah, goodbye and yeah, enjoy your day.